I'd like to, welcome you to our flagship hospital, 25 Queen Anne Street. We have 5 floors devoted to eye care and eye surgery.
We have 2 floors of diagnostics, 1 ward, and then we have a small office space. So it's probably big enough to do 3,000 to 5,000 procedures a year. It's mainly focused on self-pay customers.
Optegra has gone through a change over the last few years, particularly affected by the pandemic. We used to try to be the A to Z of all eye care, but we've decided that we would be more effective and be able to serve our patients better by concentrating on a few things.
2019-20 has been challenging years for Optegra. COVID's definitely had a big impact on our lives, also on our healthcare and how we treat our cataract patients. Our biggest challenge is probably clinical staffing. We all know about the nurse shortage across Europe. Brexit hasn't been enabling that further.
I think the pandemic, we have to accept, has been tough for everyone. It has changed the world. It has changed the way we relate to each other, how we communicate with each other. We recognize that very early on. And we had to change with it.
We standardized our pathways, we kept our staff close with us, we reopened relatively quickly. We started doing a lot of virtual consults, pre-op assessments by telephone.
It did take some time. It took a lot of training, it took a lot of adjustment. We adopted lots of new technologies, new ways of working. And for us, it was very challenging to begin with, but what made it really rewarding was that the patients really took to it.
On the pathway, some of the things that we had to adapt and learn through the pandemic, we're not going to go back to the old days. We do a virtual clinic for every single customer, and we will continue doing virtual clinics. Why? It's very handy for the patient or customers. They get an appointment with the clinicians within 1 day, and they love it. They come prepared to the hospital, they know what to expect. For cataract patients, we do with our clinical team, we do pre-op assessments, and we will continue to do that so the patient is better prepared and we can triage the patients better. Definitely, COVID has had a massive impact on the waiting list for cataract procedures.
Patients have been waiting a long time.
NHS has been struggling to cope with the demand, and elective cataract surgery, it's a surgery that you can do very easy in daycare setting. Sometimes independent service providers like us, specialized in ophthalmology, are better positioned to do that. So you've seen a shift in the market. The Royal College has published, that almost 50% of the market was outsourced during COVID.
When patients do come to us, for example, for cataract surgery, whether it's through our NHS services or through self-pay, the cataracts are at a much more advanced stage.
At the moment, we're probably doing more than 2,500 patients this year in Newcastle for cataract surgery, and we only do cataract surgery. So initially we thought to be open 1 or 2 days for surgery and 1 or 2 days for initial and clinics. At the moment, we're thinking that we're going to be 5 days open, as of next quarter, given the demand of the patients, and the expectations and the satisfaction of the patients, yeah.
One of the great things about working with the Optegra is we've got very strong partnerships with industry. We are able to introduce many new techniques and technologies which are not really available in many other places. For example, we have the new Visimax 800 laser and are able to provide the Smile Pro procedure, which is the latest version of keyhole LASIK.
This is our Visimax 800. It's the first of its kind in the UK. And we're really enjoying using it, but I think the patients are enjoying it too, because the treatment times with this machine are so quick. We can make a LASIK flap in 5 seconds, which is, hugely quicker than the older machines. And we can do a smile treatment in under 10 seconds. The patients, they come in, they lie down, they have some drops, and the next thing they're sitting up and leaving again. And they're really impressed with how quick and straightforward the treatment is.
Worldwide, the vision correction market has had a stellar 21 as a result of people, having done some savings. They prefer to have their eyes done than taking a flight ticket with the risk of COVID, etc., etc. Of course, having a mask, having fogging glasses has helped that market also to realize, what's the benefit of having no glasses, huh?
There's often a huge misconception about vision correction surgery. And, I would like people to not hesitate to come and join us for our webinars, our face-to-face meetings, or even when you have the opportunity to come and spend time with us in our clinics, you will see how safe the procedures are, how effective, how happy patients are, and the lengths that we go to ensure that patients are, number one, suitable, that it's safe to proceed, and that they will get the best results afterwards.